Welcome all my wellness people. I wanted to come on. It's been a while since I've been inside the J Wellness studio office here, and I just wanted to come in and talk to all of you. I've been reading a lot of messages on the Eustachian group 24/7 Facebook group, and I just really wanted to come in and do some kind of a live interaction here. And I just wanted to talk about red light therapy. As you can see, I got red light therapy going right now, and I want to answer some questions that I've been seeing on the group. I've been seeing a lot of questions come through, so I figured what better way to come on and talk about it and give you guys some more facts about red light therapy, infrared light therapy, and talk a little bit about that. So I have my device going, and some of the questions that you guys were asking were what type of machine should I order, and what type of machine is going to be better for me, what type of machine works better. All very valid questions for something that isn't really out there as much. You don't really hear a lot about red light therapy, actually more specifically infrared light therapy. Some of you are listening are probably wondering, what's the difference? Why alternating the words infrared and red light? Well, I've talked about that in some of my other videos, but just to give you a little bit more background about this particular video, is that infrared is the energy more so that you do not see. So the red light is simply the red light that you see from the bulb, which has a lot of healing properties, and that's more for skin and hair and things like that. But for things in this purpose of putting more circulation into where we're particularly targeting is the ear, the infrared is what's going to do the job. It's going to go deeper through the skin tissue. It's going to get targeted into that area. You have seen videos about infrared benefits, but you may have not seen benefits pertaining to ear-related conditions using this device. So that is what I'm promoting in terms of sharing that knowledge, and that's what I'm going to continue to promote and share that knowledge. And I'm going to start telling everybody about it even more so, because as conditions with the ear rise, this message needs to go out. It needs to be told by many people out there who have conditions where they're not getting the healing that they need. They're being told everything is allergy related. Obviously, folks, if you are in a deep state or a chronic state of Eustachian Tube Dysfunction, tinnitus, TMJ, you know perfectly well that allergies does play a part in it, but it may not be your particular problem. And so that's why I'm here to decipher the difference between having allergy related issues and having an issue with the jaw. Recently I've been releasing a lot of videos about massage and how important proper massage therapy is for you guys that are dealing with Eustachian Tube Dysfunction, tinnitus, TMJ, patulous Eustachian Tube disorder or dysfunction. And I need to stress on how important it is to emphasize that a lot of the issues are stemming from the jaw area. It's stemming from something called the SEM muscle. It's something stemming from your masseter muscle. It's stemming from your temporalis muscle, which are the muscles up here near the temples. That's why when you have tension headaches, we always say massage the temple, which is your temporalis muscle. So for some of you that may not understand where that word comes from, it comes from that. So this is what's not being, again, this is my opinion, this is what's not being described very well. When we go into visits, we see an ENT specialist. Nothing against the ENT specialist, doctor, physician, is that we're treating allergies most of the time. The camera goes up the nose. It's being evaluated that, okay, there's some swelling going on there. There's some inflammation. Got it. Which is, I want to say, most of the case, most of the time, unless you've had a very distinctive injury to the jaw or something that you know of, where it came from, things like that. You play a sport, got knocked a little bit. So yeah, we know that can happen. But if you are just like myself and you just woke up one day and all of a sudden you felt a little congestion in your ear and in your nose, and you're like, okay, what the heck is going on? Where is this? You think it, okay, yeah, you really do think it's allergies, because allergies is one of those things that it happens kind of sporadically. It gets better, it gets worse, it gets better, it gets worse. So you start going the allergy route. You start trying to treat that issue now. Well, that's all well and good and fine, but you still have issues here. You have issues with the jaw, and I want to really plug a percentage on how many people I've talked to that have actually ended up it being a muscular related issue with the ear, comparable to people who actually had a legitimate allergy problem. I'm gonna say the balance is way towards the people who had issues with their jaw that ended up getting relief with the jaw area and then getting better, versus people who just took some medication with their allergies and then eventually, But I'm gonna tell you that right now, most of the time, it really is derived from the area of the jaw and the posture and focusing on that area. See, the thing about it is, when people watch my videos, which is pertaining, I specify in these three to four categories: tinnitus, TMJ, Eustachian Tube Dysfunction, and patulous Eustachian Tube Disorder, which for some of you listening are when your Eustachian tubes are closed and you hear your own voice when you're speaking, which is another. The reason why I don't group that with Eustachian Tube Dysfunction and tinnitus and TMJ is because it's kind of its own entity in a way, even though it's highly comparable, but it's opposite, if that makes sense. So it's hard to explain those two. But if you are watching this video and you're struggling to figure out why you can't get a definitive answer of why you have this condition, I'm telling you, because a lot of people, doctors, specialists, first of all, they're overwhelmed in the medical field, that particular medical field. They are flooded with allergy patients, especially if you live in a area where it's there's lots of allergy related symptoms with trees and seasonal issues. You're going to be, those doctors are flooded with allergy related patients. It is very rarely that they get patients like ourselves who trickle in there and they start complaining about these symptoms, and those symptoms almost always match with allergy symptoms. I was one of them. I can't tell you how many doctors I've had a doctor tell me just move. I've had a doctor get me on medication that didn't help. Then when I would go back and tell them it wouldn't help, they just say, well, there's always surgery. And it's like, it's hard to find. The problem with our medical society is that we literally need someone to almost be our case worker, our case manager. They need to follow every little thing we do in order to really diagnose and really treat what we're having. It's almost, I almost want to use the word impossible, but I'm going to say it's very difficult for one doctor or two or three to see hundreds of patients every week and to be able to correctly identify their main proprietary issue of why they have this condition, because they're seeing so many of them and they're trying to get them all in and squeeze them here and there and on the chart, on the schedule here and there. You literally would have to follow that patient everywhere there. You would have to be in touch with that particular patient every step of the way. And how many doctors do you see that are following you every step of the way? And how many doctors do you see that even remotely remember who you are the next visit? So the reason why I want to say this condition is hard for physicians, again, it's not taking away their medical and intellectual abilities. It's more so the fact that they're not able to correctly track each patient. And what's also even difficult is the patient to be able to basically, when you go into a visit, you're almost defending yourself. You have to use the right verbiage, you have to use the right lingo, you have to be precise on when things happen and when things don't happen. You have to almost know a little bit of the terminology. You don't have to be a professional, but you need to almost represent yourself very well to get better results from the visit. And that's the problem. When I am doing these videos, it's not to say, oh, doctor doesn't know anything. It's saying that when you compare the variables of the person going into the visit, of maybe not compiling the right data to give to that doctor, and then that doctor having the amount of resources to target that particular patient individually to follow them through whatever it is they're dealing with. Like if you see a psychiatrist, or you have a case manager, or you're a female patient and you are going through your labor course, those doctors are more in a trackable sense with you, where it's like they are expecting this to happen, they're expecting that to come next, and they're following you all the way through the process. Well, this condition, I have to say, in this particular field, in my opinion, I'm going to always say my opinion because I don't want things to get misconstrued. My opinion is that this isn't really a trackable, doctors aren't really tracking you, because I would go into a visit and they'll treat me as a one-stop shop. Most of them, not all of them, most of them. Give me a little of this and that, and then I go on about my business. Little that they know, I'm back in there and I'm saying, hey, this isn't working. It took me about 5 times, and that's a lot. So that's why I do my videos. That's why I'm so consistent on the J Wellness Studio channel, because I'm not going to give up, because I know how difficult it is to get proper information and get proper feedback and proper education, and things are really all over the place. You literally have to be your own case manager. You have to be your own you have to be your own lawyer. You have to arrange. When I would go into the visit, I would have papers from other visits, notes, everything. I would have to do all. Imagine doing that and being not well. And that's sad, because we have to do that stuff and not be well. I mean, I'm sitting here, I would compile all this information from previous visits, medications from previous visits. I had everything. I had my folder with me. I would hold it with me, and I'd go into these visits. I said, look, we did that. When they would say anything that would align with what I already been through, I would say, nope, here it is. This is what I did. And imagine doing that, feeling this pressure, this congestion, the dizziness, the headaches, the tightness, the stiffness, the worry, the anxiety, the pressure, all this stuff. You're feeling all this stuff, and you're still there fighting for yourself, because you're fighting for the information to make sense. So then you go back to Facebook or YouTube, and you end up getting more out of that than the doctors, because those people are in your shoes. They've been there. They're spending time with you. They're learning who you are. They're adding. So that's who I am, in a sense. I'm not a physician. I'm not going to diagnose you. I'm not going to recommend medication. I never have done any of those things on this channel. But I'm going to be with you. I'm going to decipher what was just told to you, and I'm going to try my best to identify what was told with you in correlation to what was been told with me, so you can make the determination of if it's an accurate prognosis of what you have, a factual diagnosis of what you're dealing with, because you live here. This is where you live. This is not where they live. They know what they see and what they observe, but they don't know you. So that's what makes it hard in this diagnosing Eustachian Tube Dysfunction, Tinnitus, TMJ, is because they don't know you and they don't know what you're doing. They're just going by what you tell them. It's almost like it's like calling an auto body shop, a auto body car repair shop, and just explaining everything. They're gonna need to see everything that's going on to really figure out what's happening. And some of you might say, well, isn't that what they're doing when I go into the visit? Well, true, but unlike a car, it's pretty standard. You're not a car. You're more intricate. You're more intricate than that. You're more complicated than that. It's diet, it's rest, it's nutrition, it's habits, it's where you work, it's what you just went through yesterday. Did you have a family problem? Did somebody have an issue in your family that's causing you stress? Where you need to not only be involved in that visit, but you need to be involved with that person. So that is why I made this video. I am explaining you as I sit under this amazing light, which, by the way, if you can see here, it's timed. Let me get it right on there. So that way, if I want a little more time, I hit that button and I get a little bit more time. So that is the amazing thing. And I know I kind of got off another track, because this was weighing on me to talk about what you guys are going through, and I needed to go over that stuff. So quickly, I'm going to talk about the machine. The way you know it's infrared, it literally says it. Most of them should say it. Ceramic infrared, 300 watt. That's how you know this isn't just a red bulb. So folks, I want you to get in. If you didn't get anything out of this video, I hope you did, but If you just strictly came here for the red light information, then that's fine. When you are purchasing your own machine, just be sure to see that it says infrared, because I can go and buy a red light bulb from Home Depot, pop it into a lamp and say, oh, I have infrared light therapy. You don't. You have a red bulb that's, you know, sending out red light. It's reflecting red light from the red surface of the bulb. So make sure it says infrared, because that's when you know you're getting the best of the best. So 300 watts is what's good for me. This is what I always have going all the time on me. I recommend 15 minutes or so. Some of you ask, how long do you do it for? I always say 15 minutes in the ear that's hurting the most or bothering you the most. Of course, if you're in severe pain, don't rely on the red light therapy or infrared light therapy. Make sure that it's something you can deal with already if you're going in this route. So I hope this video was helpful for you. I wanted to give you guys a little encouragement I wanted to encourage you a little bit more in this video. This was my main idea, was to come on here to kind of give you guys a little more information about what's been going on, and a little bit infrared light, not too much infrared information, because I think there's so many videos of infrared light that I have on my channel that I think you guys all will enjoy. I'm going to be doing more infrared light videos though, but this one wasn't the particular one that I'm doing. But again, if I have the link in the description of the machine, they look a little bit different, but nonetheless they're still 300 watt infrared compatible. So you're going to get a lot of good feeling. You're going to get a lot of good health benefits with those particular machines. This one I've been using for 5, maybe longer, 6, maybe 5 years, and it's been running perfectly. Haven't had to change any bulb or do anything. It's been running great, and I hope to connect with you guys a lot more. I've been doing a lot of YouTube shorts, little things to stay connected with all of you out there. So I hope those are good for you guys, as well as I did talk briefly that I do want to start gifting some of these to you guys out there. So if you're interested, comment in the comment section, and hopefully I can gift you guys some of this. If you haven't already tried your own machine, I want to help. I want to help gift you guys a machine so you can try it for yourself if you're not sure. So alrighty, my wellness people, I hope this video was very helpful for you. I'm gonna do more videos about red light therapy. I just wanted to really rant a little bit more about doctor visits and things that some of you are going through, but I will save the red light therapy for another video that I'm going to do a longer session and maybe talk more about it, maybe open up the discussion panel for some of you that may have some direct questions for me. But the heat's getting a little warm, so I think I'm going to go ahead and step out of the J Wellness studio and leave you in good hands with this video. I ask you all to subscribe to my channel so you can get the latest, greatest health and wellness videos, motivation, yoga, and meditation. But before I let you go, I'd like to leave you with one thing. Being well is feeling well. Feeling well is doing well. Doing well is living well. Take care, everybody. I will talk to you soon.